Welcome to Studious. Today, we begin one of the most intellectually transformative subjects in all of medicine, general pathology. If pharmacology teaches you how to treat disease and physiology teaches you how the body works normally, then pathology answers the most fundamental question of all: what goes wrong and why? Pathology is the diagnostic lens through which every disease is identified, understood, and ultimately defeated. Without it, clinical medicine would be nothing more than guesswork, prescribing treatments for conditions that are not properly understood. Every cancer diagnosis, every laboratory test you order, every biopsy result you interpret, every post-mortem finding, all of these are products of pathological science. The image on this slide captures the essence of what pathology studies. A normal cell on one side, structured, organized, functioning, and a diseased cell on the other, swollen, disrupted, losing its architecture. This single visual tells the entire story of pathology. In this foundational lesson, we will build your complete conceptual framework, from the definition of disease itself to the 4 essential pillars of disease comprehension that every clinician must master. This is the foundation upon which all of clinical medicine is built. Let us begin.
Before we can study disease, we must first establish its reference point, the baseline of health. And to truly understand what health means, we need to go beyond its everyday, casual usage and think about it in the precise, multidimensional terms that medicine demands. The World Health Organization defines health not merely as the absence of disease, but as a state of complete physical, mental, social, and emotional well-being. This 4-dimensional definition is depicted in the radar diagram on this slide. A healthy state occupies the maximum area across all 4 axes simultaneously. The moment any single axis is compromised, the healthy state contracts and disease begins. Now consider the word disease itself. It is a compound of 2 simple English words: dis, meaning un or not, and ease, meaning comfort. Disease is literally the state of unease, an uncomfortable deviation from a healthy baseline. This etymology is not merely linguistic trivia, it is philosophically profound, because it reminds us that pathology is not about abstract molecular processes in isolation. It is ultimately about a living person who is suffering. A person whose physical axis has collapsed due to cancer, whose mental axis has fractured due to schizophrenia, or whose social axis has been destroyed by chronic disability. All are experiencing disease in its fullest medical and human sense. Pathology exists to understand and reverse these deviations.
The word pathology comes directly from the ancient Greek language and breaks into 2 precise roots. The first root is pathos, meaning suffering. The second root is logos, meaning the study of. Combined, pathology is literally the study of suffering, the systematic scientific investigation of how and why living organisms suffer from disease at the cellular, tissue, and organ level. But the formal academic definition goes considerably deeper. Pathology is defined as the study of structural, biochemical, and functional changes in cells, tissues, and organs that underlie and lead to disease. Let us unpack this definition word by word, because every component is critical. Structural changes refer to physical alterations in the size, shape, architecture, and arrangement of cells and tissues, changes that are directly observable under the microscope or with the naked eye at autopsy. Biochemical changes refer to abnormal molecular and chemical processes occurring within diseased cells, disrupted enzyme systems, aberrant metabolic pathways, abnormal protein production. And functional changes refer to how these structural and biochemical abnormalities ultimately translate into impaired organ performance. The study of pathology integrates all 3 of these dimensions simultaneously. A pathologist looking at a tissue biopsy is not just describing what they see under the microscope. They are decoding the entire chain of events that connects a cellular injury to a patient's clinical suffering.
Every disease process, regardless of its cause or the organ it affects, produces damage through one or more of three fundamental categories of pathological change, the triad of pathological change. Understanding this triad is foundational because it provides the organizational framework within which every disease you will ever study can be classified and understood. The first category is structural changes, physical alterations to the size, shape, or architectural arrangement of cells and tissues. Consider anemia as a classic example. In microcytic anemia, such as iron deficiency anemia, red blood cells shrink, becoming smaller than normal. In macrocytic anemia, such as vitamin B12 or folate deficiency, red blood cells enlarge abnormally. These are pure structural changes, directly visible under the microscope, that immediately tell the pathologist something fundamental about the underlying disease mechanism. The second category is functional changes, disruption of the normal physiological operations of an organ. When the sinoatrial node of the heart fails, as in sick sinus syndrome or complete heart block, the heart loses its ability to generate and coordinate electrical impulses effectively, resulting in heart failure. The structural component may be subtle, but the functional consequence, impaired cardiac output, is what kills the patient. The third category is biochemical changes, abnormal chemical processing within diseased cells. In severe liver disease, the failing liver converts excess circulating ammonia into massive quantities of urea via the urea cycle, producing hyperammonemia and eventually hepatic encephalopathy.
Here is the single most important conceptual statement in all of pathology, and one of the most important in all of medicine. You cannot jump directly from normal physiology to clinical treatment. There is a gap, a chasm of understanding between knowing how a healthy organ functions and knowing how to treat a diseased one. That gap is bridged by pathology. Physiology tells you that the normal kidney filters blood, maintains electrolyte balance, and produces urine. Clinical medicine tells you that a patient with renal failure needs dialysis, fluid restriction, and erythromycin. But how do you get from one to the other? How do you know that this particular patient's kidneys are failing? How do you know what type of renal failure it is, pre-renal, intrinsic, or post-renal? How do you know whether the glomeruli are damaged, or the tubules, or the interstitium? How do you determine whether the cause is diabetic nephropathy, hypertensive nephrosclerosis, or IgA nephropathy? The answer to every one of these questions is pathology. Pathology identifies the precise cause of the deviation from normal function, characterizes the extent and nature of the structural damage, traces the biochemical mechanisms through which that damage was produced, and thereby provides the specific diagnosis upon which rational clinical treatment can be built. The guiding principle of this slide captures it perfectly. We cannot treat what we do not understand. Pathology is the science of understanding.
Pathology as a discipline is organized into two major branches, general pathology and systemic pathology. And understanding the distinction between them is absolutely essential for structuring your study and orienting yourself within the vast field of disease science. General pathology is the foundational branch. It studies the body's universal, tissue-agnostic responses to injury, the common mechanisms through which cells and tissues react to injurious stimuli, regardless of which organ is affected and regardless of the specific cause of the injury. Inflammation, cellular adaptation, cell death, neoplasia, hemodynamic disturbances, and immune responses are all topics of general pathology. When a bacterium invades any tissue in the body, whether it is the lung, the skin, the meninges, or the peritoneum, the fundamental inflammatory response that tissue mounts shares the same core cellular and molecular mechanisms. That universal response pattern is what general pathology studies. Systemic pathology, by contrast, studies diseases that are specific to individual organ systems. Diseases whose characteristics are determined by the unique anatomy, physiology, and cellular composition of the organ in which they occur. Heart failure from sinoatrial node dysfunction can only occur in a heart. It cannot occur in the kidney or liver because those organs do not have SA nodes. Diabetic nephropathy only affects kidneys. Hepatocellular carcinoma only affects liver parenchyma. These organ-specific disease patterns are the domain of systemic pathology.
To make the concept of general pathology concrete and vivid, let us examine its most clinically important and universally relevant example, the inflammatory response. Inflammation is defined as the local vascular and cellular response of living tissues to injury or infection, a precisely orchestrated biological defense mechanism that evolved to protect the body from microbial invasion, toxic substances, and physical trauma. The classic signs of acute inflammation were described by the Roman physician Celsus nearly 2,000 years ago and remain valid today. Redness, rubor, caused by vasodilation and increased blood flow; heat, calor, from the same vascular response; swelling, tumor, from increased vascular permeability allowing plasma proteins and fluid to leak into tissue; pain, dolor, from chemical mediators stimulating nerve endings; and loss of function, functio lesa, from the combination of swelling, pain, and tissue damage. Inflammation is the archetypal example of general pathology in action because it occurs in every tissue and every organ in response to virtually every type of injurious stimulus. It divides into two fundamental patterns. Acute inflammation is the rapid, immediate, short-duration first-line defense, dominated by neutrophils, vascular changes, and exudate formation, typically resolving within days. Chronic inflammation is the prolonged, sustained response that persists when acute inflammation fails to eliminate the injurious agent, dominated by mononuclear cells, tissue destruction, and attempted repair occurring simultaneously over weeks, months, or years.
To fully understand any disease, to truly crack its code and translate it from a confusing collection of symptoms and test results into a treatable clinical reality, a physician must systematically analyze it across 4 essential dimensions. These 4 dimensions form the complete diagnostic framework of pathology, and together they constitute what pathologists call complete disease comprehension. The first dimension is etiology, the cause. The second is pathogenesis, the mechanism. The third is morphology, the structural change. The fourth is clinical manifestations, the functional impact. Think of these 4 dimensions as 4 interlocking puzzle pieces. Only when all 4 are understood simultaneously does the complete picture of the disease emerge. A clinician who knows only the etiology of a disease without understanding its pathogenesis cannot predict its complications. A clinician who can recognize the morphological changes without understanding the clinical manifestations cannot correlate laboratory findings with patient symptoms. A clinician who knows the clinical manifestations without understanding the etiology cannot select a curative treatment rather than a merely symptomatic one. The power of pathological thinking is that it demands simultaneous competency across all 4 dimensions. It is not satisfied with partial understanding. Every examination question you will face in pathology, MBBS finals, USMLE Step 1, postgraduate entrance examinations, is ultimately testing your ability to navigate these 4 dimensions for a specific disease.
The first 2 pieces of the diagnostic puzzle, etiology and pathogenesis, together tell the story of a disease's origin and progression. Etiology is the study of the root cause of a disease, the initial injurious event or predisposing factor that sets the entire disease process in motion. Etiological factors are organized into 2 fundamental categories. The first category is genetic etiology, diseases caused by inherited abnormalities in the DNA that are passed from parent to child through the germline. Examples include sickle cell disease, caused by a single point mutation in the hemoglobin beta chain gene; cystic fibrosis, caused by mutations in the CFTR gene; Huntington's disease, caused by CAG trinucleotide repeat expansion. These diseases are present from conception, encoded in every cell of the body. The second category is acquired etiology, diseases contracted from the external environment after birth. These include infectious agents, bacteria, viruses, fungi, parasites, physical agents, trauma, radiation, extreme temperature, chemical agents, toxins, drugs, environmental pollutants, nutritional deficiencies, and immunological disorders. Once the etiological trigger fires, pathogenesis begins, the timeline of disease development. Pathogenesis describes exactly how the disease develops, progresses, spreads, and produces its characteristic features through specific molecular and biochemical mechanisms. Understanding pathogenesis is critical because it reveals the precise intervention points where treatment can interrupt disease progression, the molecular targets for drug therapy.
The third and fourth dimensions of the diagnostic framework, morphology and clinical manifestations, complete the disease story by documenting what the disease does to tissue structure and what the patient consequently suffers. Morphology, from the Greek morphe, meaning form, refers to the physical, observable alterations within cells, tissues, and organs caused by disease progression. Morphological changes are studied at two levels. Gross morphology refers to changes visible to the naked eye, the appearance of organs at surgery or autopsy, a heart enlarged by hypertrophic cardiomyopathy, a lung consolidated by pneumonic infection, a liver studded with metastatic tumor nodules. These are gross morphological changes. Histological morphology refers to changes visible only under the microscope: cellular swelling, nuclear pycnosis, inflammatory infiltrates, granuloma formation, dysplastic cell architecture. Morphology is the direct output of the pathologist's microscope. It is what the pathology report describes, what the biopsy reveals, and what determines tumor grading and staging. The fourth dimension, clinical manifestations, describes how the morphological changes translate into the functional deficits and symptoms that the patient experiences. When the glomerular architecture of the kidney is destroyed by immune complex deposition, the clinical manifestation is proteinuria, hematuria, and eventually renal failure. The structural change and the functional consequence are inseparably linked, and understanding both is what makes pathology not just an academic exercise, but a direct clinical tool.
We now arrive at the synthesis, the complete diagnostic pathway that integrates everything we have studied in this lesson into one unified, linear model of disease comprehension. The pathway begins with the healthy state, an organism in complete physical, mental, social, and emotional equilibrium. An etiological trigger, genetic or acquired, disrupts this equilibrium, setting pathogenesis in motion. Disease develops and spreads through specific molecular mechanisms, producing structural morphological changes in cells, tissues, and organs. Those structural changes generate functional deficits that manifest as the observable clinical symptoms and signs that bring the patient to your clinic. The pathology bridge, the systematic application of everything we have studied today, allows the clinician to analyze these clinical manifestations, trace them back through morphology and pathogenesis to the root etiology, and thereby arrive at a specific diagnosis upon which rational, evidence-based treatment can be built. The closing statement of this lesson encapsulates the entire discipline. Pathology is the systematic decoding of this entire pathway, transforming suffering from a mystery into a treatable clinical reality. In our upcoming lessons, we will take each component of this pathway: cell injury, inflammation, neoplasia, hemodynamics, immunopathology, and study it in the depth and detail that your examinations and clinical career demand. Please like, comment, share, and subscribe to Studious. The diagnostic lens is now in your hands.